Thank you for tuning in to Airplane Arms, Navigating Back to School. I'm Jen Petronas, the Director of Health Services for the Anchorage School District, and today we're going to be talking about masking and what that looks like when we return to in-person learning. With me today, I have Dr. Patricia Clay, pediatrician of South Central Foundation, and also the School Health Liaison for the American Academy of Pediatrics Alaska chapter. I also have Kathy Bell, pediatric intensive care nurse, charge nurse at Providence Hospital, and also school nurse of Golden View Middle School. Thank you for being here with us today.
Thanks for having us. Thank you.
Dr. Clay, one of the most common comments and questions that I get from parents and community members is the fear that their child can't breathe while wearing a mask. Can you talk to us a little bit about that?
Yeah, of course. That's a really common concern right now that a lot of parents are asking us as well. And unfortunately, there's a lot of false information floating around about masks and oxygen levels. The purpose of wearing a cloth face mask is to create a barrier to prevent the spray of respiratory droplets or spit or saliva when we cough or laugh or sneeze or just even talking. These respiratory droplets can carry the virus that causes COVID-19, which is why we're worried. And we're especially worried in people who have the virus but don't show any symptoms, which means they don't know that they should stay at home and not be in the group setting. So while cloth face masks can prevent the spray of respiratory droplets, or at least help decrease it, it easily allows oxygen in and carbon dioxide out because those are really tiny molecules and they easily pass back and forth. For people who wear masks all day at baseline, that could be people in healthcare such as surgeons or nurses or respiratory therapists. They have been wearing masks all day, 12 hours a day, for years and years without any decreases in their oxygen level or increases in the carbon dioxide level. I do think there's an adjustment period for kids to get used to masks, which I think we'll talk about in a minute. But I think what most kids are experiencing is this kind of new sensation or difficulty having something on their face. And with practice and parental support, they can definitely adjust.
So it doesn't cause you to lose oxygen level or breathe in more carbon dioxide?
No, it doesn't. When you think about a cloth face mask, it's really just a piece of fabric or two pieces of fabric. And you think about even the clothes that you're wearing, and air easily comes in and out all the time, and that's all breathing is moving air in and out. So oxygen's coming in and carbon dioxide is coming out just like it is normally.
Okay. Well, who shouldn't be wearing a face mask?
That's a good question too. The vast majority of children can wear a face mask easily and safely. The only exceptions are children under the age of 2, children with cognitive or developmental delays or disabilities that would prevent them from safely removing a mask on their own. And then the last group would be people with very severe asthma or severe chronic lung conditions. But I would argue that if someone has severe asthma, that they're having daily symptoms, things like that, they probably shouldn't be going to school in the first place, and they also should really touch base with their pediatrician. For those with more chronic lung conditions, I would encourage parents to reach out either to their pulmonologist or their pediatrician for more guidance.
All right, thank you. Kathy, Dr. Clay mentioned that a good way to get children used to wearing a face mask is to practice. Can you talk to us about some good ways to help children get used to wearing a mask?
Well, most children, I hope, have gotten used to it a little bit now, because when they're going out in public, if they're greater than 3 years of age, then they should be wearing it when they go to the store, when they go any place with their parents, go to any social events, along with staying 6 feet back. But they can also practice wearing it at home. So we're starting this year off with school online, virtual, and children can practice wearing the mask during their school time also, or during different times at home, like if they're watching a family movie together, they could practice wearing their mask. I also think it's important to practice taking the mask off and which way to place it on the table, and also practice putting it on and off for if you want to have something to drink or have food.
Well, then when you do take it off, then how are you supposed to place it on the table?
Well, you want to make sure that you're placing, I'm going to show you with this mask actually. If this is the outside of your mask, you want to make sure that the clean side is facing up, and it's best to put it on something like some type of barrier, like maybe a paper towel or a piece of paper that you're using just for that. And then the part that you're putting close to your face, you want to make sure that that's not touching any other surfaces that may be dirty.
Well, Kathy, I have a second grader, and he's extremely active and gets very sweaty. How often should he be changing his mask, and how many masks should I be bringing to school with him?
Well, you should probably send some extra masks in his backpack because a lot of second graders are probably going to be experiencing that. They also could be drinking something and spill something on their mask. So if their mask is moist or feeling uncomfortable, it's a good time to change it. And the best thing is probably to make sure they put it away, like in a baggie or something in their backpack, and get out a clean one, which means you'll probably have to be washing more masks at home at night to send in. We also provide masks at the school district for emergencies. If a kid didn't have enough masks with them and they got all 3 of them soiled or they felt too moist to be wearing them, the ones that provided will be looking like this. And they can use these type of masks. There's some made just for kids and some of them that even have cartoon characters on them, so they will like wearing them, most of them. And so they're welcome to use those too.
So what type of mask do you suggest that children wear? Is there a one that's better than the other, or can you kind of go over that with us?
Yeah, there's lots of different type masks. There's this type, which is a surgical mask, and they make a children's form of this. The one that I've seen most commonly at the hospital has little Disney characters on it, and it's really cute. Kids love wearing it. And this is probably really good protection. But also there's cloth masks made just for children, and there's ones that have loops like this that go behind your ears, which for some people can be a little irritating. So there's also these type that you can just tie, and you can tie them like this, and then tie the other part down like this. So all the ties are in the back and they don't have any movement around the ear part. Because I do find myself, if I have to wear one for 12 hours, it's a little bit irritating. They can also wear some different type, there's lots of different type of face shields out here. Here's just one of them. And they can put the face shield on also to wear like this. And this one doesn't have all the pieces to it, but it does usually have a piece of foam right here so that it's resting on the head. And they're all very comfortable.
So it looks like there's a lot of options out there for different types of face masks. Well, how many face masks do you recommend that I bring with my son again?
So I would he'd wear one of course to school, and I would send 2 or 3 extras. And then if he goes through that many, we'll try to figure out why he's going through so many to begin with. And then we also have some available at school for emergencies.
Okay. And so for emergencies, if my son needs to get one, who does he see to get that from, or how does he get one?
Well, we'll probably have a limited amount in the classroom for the teacher to give out, because we don't want any children walking around in the halls without a mask. Or the teacher can always call me and say, so-and-so has a mask on, it's a 3rd one today, and it's now really moist and it's irritating to them. Could you bring me a mask? But I suspect we'll have a limited amount in each classroom.
All right, thank you. Dr. Clay, if I have a parent that's just really concerned about their child wearing a mask and is fearful, where should I direct them, or who can they talk to help calm their fears, or maybe even provide some education on that?
Yeah, I would really encourage parents to reach out to their child's doctor's office. I know our team has been fielding a lot of questions about masks in the past couple weeks, couple months really. We're lucky enough in our office to have behavioral health consultants too, who've done a lot of work with families and with kids in particular. I do think that even just having parents reach out to their pediatrician's office, so we can also check on any other chronic medical concerns and why are they so worried about their kids wearing masks, what are the pros and cons, and making sure that their well visits are up to date and immunizations are up to date. I'd really encourage parents to reach out. We're there to hear from you, and this is a really uncertain time, so I would use the medical home for your kids as much as you can.
All right. Can they also reach out to their school nurse, Kathy, if they want to talk about that?
For sure they can. That's what we're there for, to help children get through their day. And sometimes all we need to do is talk for a couple minutes to the child, and they feel comfortable then. There's also, in many of the schools, have social workers or high school or middle school or high school counselors, and those people can also help with that. And I know I'll be providing some education to my counselors too, to help in case I'm busy with assessing sick children. They can help them with their mask concerns. But for sure, that's what we're there for. I hope they come and help, and I can offer them help. And also, I hope parents will call me.
Okay. Is there anything else that you want to add that I missed today?
I mean, I would like to emphasize that I think one of the best ways to get kids used to wearing masks, and like you said, I hope they're already kind of used to it, or we are, but is really modeling from parents, right? So every time kids are leaving the house, parents should be wearing masks, kids should be wearing masks, and even in the house, I think with kids who are home with parents, with guardians during the day, if they're going to practice during the day, I mean, have the guardian or the parent practice with them. I think that it's much easier for them to learn and by seeing it, and so making it normal, because that's what's normal right now. So.
Yeah, that's a good tip. I know that my children always remind me to bring my mask whenever I leave the house, because it's a habit that I'm not used to quite yet. Anything else that I missed, Kathy?
No, the modeling is a great idea though, because I know if they see us doing it, they'll do it. And they see their friends doing it. You know, peer pressure is the biggest one of all for most school-age children. If they see their friends doing it, they'll want to do it too.
Well, thank you for being here with us today, Dr. Clay and Kathy, and thank you for tuning in.